my forehead really that big? Hey, did you know that psychiatric medications can save lives? Advances in psychopharmacology over the past couple decades have made these medications more understood, more effective, and more targeted than ever before. But there's a lot of misunderstandings, especially about the black box warnings. These warnings aren't just about danger. They're also about ensuring legal and insurance protections. Not a big fan of those two. Yes, medications can make you feel better, but sometimes they don't alleviate the symptoms enough, which can actually increase your chance of a permanent nap. That doesn't mean you shouldn't try meds. You just need to try them carefully and with the help of a doctor. This is why you must be honest with your doctor. Finding a doctor who truly listens and collaborates with you is your best bet for effective treatment. Medications are often prescribed quickly because we don't know how risky an individual's full risk is. And the reality is the meds work most of the time. They work more often than they don't. And as a class of medicines, psychopharmaceuticals, psychiatric treating drugs, or mental health assisting chemicals are increasingly effective. They are as a group. Everybody has different body chemistry. It varies so much that you need to try multiple medications of the same class to get different profiles of affinity binding. It's complicated, what's the word? Pharmacodynamics or something like that. So anyway, give each medication a genuine effort. It usually takes 2 to 4 weeks to know if it's working or not working. I know it sucks. It sucks so much, but it's the best we have right now, and it does work. If you have major side effects, there's usually a med to treat those side effects. It's not as bad as it sounds to take a med for another med. We study these drugs very deeply, and we understand what they do for the most part. Anyway, you'll need to try multiple medications to find one that helps you the most with the least side effects. So give each medication a genuine effort of 2 to 4 weeks before asking for a change. Sometimes side effects are bad enough that stopping or lowering the dosage, which is just as good of an option, is necessary sooner. But always be patient and try to stay calm. Just communicate with your doctor everything that you're experiencing without being too pestering, or they'll stop listening to you maybe, because they're people too. Give them some grace. But explain everything to your doctor. Make sure they can hear you, are hearing you, are actively listening, and are taking your opinions into an account, because a personalized care is more effective than any other care. The doctors are supposed to be your biggest ally. If your doctor isn't an ally, start looking for a new one, and please don't go to alternative healthcare. Stick with professional doctors if your issues are strong enough. Alternative health treatments are for very mild stress or mild issues. They may do nothing. It's crucial to use these medications because the risk of taking a permanent nap due to mental illness is very high. Not alleviating the emotional pain fast enough can feel terrifying. So remember, working diligently with your doctor, trying medications with patients, and staying in honest communication are key. Your well-being is worth it. Stay positive, stay hopeful, and know that help is out there. For more on this topic, I'm going to make another part 2 with more info on other drug safety. Don't miss it!